If you're a manager, I need you to stop diagnosing your employees. She's bipolar. He's definitely a narcissist. He has anger issues. She has ADHD. Maybe, and maybe not. And unless you're a mental health professional who has evaluated that person, you don't know if they have a mental health diagnosis. And it's not your job to know if they have a mental health diagnosis. Your job is to manage the behavior that that employee is displaying. This is where some managers get into trouble. You start to try to figure out what's psychologically wrong with someone instead of trying to determine how am I going to manage this behavior that this employee is displaying. You don't have to say, I think your anxiety is affecting your performance. What you can say is, I've noticed that you've missed 3 deadlines this past month. Let's talk about what's getting in your way. Do you notice the difference? One is an assumption about somebody's mental health, and the other is addressing directly the behavior that needs to be managed. And here's the important part. If your employee decides to divulge their mental health challenges or any type of mental health diagnosis, that's a different conversation. And your organization should have processes in place to be able to manage that conversation and then what happens after that. But your job as a leader is not to diagnose your employees. Your job as a leader is to lead them. Address the behavior, clarify the information, ask good questions, and then document what needs to be documented. And then know when to involve HR or another needed resource. And that is psychologically informed leadership without pretending to be somebody's psychologist.